Medical billing is a crucial part of the healthcare system, ensuring that healthcare providers are reimbursed accurately and timely for the services they deliver. Professionals in this field handle patient records, insurance claims, and billing codes while maintaining confidentiality and accuracy. Interviews for medical billing roles often assess both technical knowledge and attention to detail, as mistakes can lead to claim denials or financial discrepancies. In this video, we will discuss common medical billing interview questions, along with sample answers and practical tips. This will help candidates demonstrate both their understanding of billing procedures and their ability to perform tasks accurately under pressure. The role of medical billing professionals. Medical billing professionals are responsible for processing claims, verifying patient information, and ensuring accurate documentation of medical services. They work closely with healthcare providers, insurance companies, and patients to resolve billing issues and maintain compliance with regulations. During interviews, employers look for candidates with a strong understanding of medical coding systems, attention to detail, and the ability to handle sensitive information with discretion. Preparing with structured answers and real-world examples can help candidates stand out. Question 1. Can you tell us about your experience in medical billing? Here's how you can answer. I have over 3 years of experience in medical billing, working with both outpatient and inpatient services. My responsibilities included processing insurance claims, verifying patient information, and coding procedures accurately using ICD-10 and CPT codes. I also assisted in resolving claim denials and ensured timely submission of bills. One of my key achievements was improving the accuracy of claim submissions by implementing a double-check system, which reduced errors by 20%. Tip: highlight relevant experience, technical skills, and measurable achievements to demonstrate your capability. Question 2. What medical billing software are you familiar with? Here's how you can answer. I am proficient in using medical billing software such as Epic, Careo, and Advanced MD. I have experience entering patient data, generating invoices, and tracking claim statuses. I am also comfortable learning new systems as required, and I always make sure to follow best practices to maintain data accuracy and compliance. Tip: emphasize your familiarity with software, adaptability to new systems, and adherence to accuracy standards. Question 3. How do you ensure accuracy in coding and billing? Here's how you can answer. I ensure accuracy by carefully reviewing patient records, cross-checking coding guidelines, and using reference tools for ICD-10 and CPT codes. I also double-check claims before submission and maintain detailed documentation of any adjustments. Regular training and staying updated on coding changes help me minimize errors and maintain compliance with regulations. Tip: show a methodical approach and commitment to maintaining high accuracy standards. Question 4. How do you handle denied or rejected claims? Here's how you can answer. When a claim is denied, I first review the reason for denial in detail. I verify patient information, codes, and documentation to identify any discrepancies. After correcting errors, I resubmit the claim promptly. I also communicate with insurance companies and healthcare providers to resolve complex issues and prevent future denials. Tip: highlight problem-solving skills, persistence, and effective communication in handling claim denials. Question 5. Can you explain the difference between ICD-10 and CPT codes? Here's how you can answer. ICD-10 codes are used to classify and code diagnoses, while CPT codes are used to describe medical procedures and services provided to patients. Accurate use of both is essential for proper billing, insurance reimbursement, and maintaining compliance with healthcare regulations. Tip: provide clear and concise explanations that demonstrate technical knowledge. Question 6. How do you manage patient confidentiality and sensitive information? Here's how you can answer. I strictly follow HIPAA guidelines and organizational policies to protect patient information. I ensure that records are securely stored and only accessed by authorized personnel. I am also careful when sharing information over email or phone, verifying identities and using secure communication channels. Tip: demonstrate understanding of legal compliance and ethical responsibility. Question 7. Can you describe a challenging billing situation you handled successfully? Here's how you can answer. In one instance, a patient's insurance claim was repeatedly denied due to incorrect coding of a procedure. I reviewed the patient's chart, consulted with the physician's office, and corrected the coding. I then resubmitted the claim with proper documentation, and it was approved. This experience taught me the importance of attention to detail, collaboration, and persistence in resolving billing issues. Tip: use real-world examples with measurable outcomes to show problem-solving ability. Question 8. How do you stay updated with changes in medical billing regulations? Here's how you can answer. I regularly attend webinars, read professional journals, and participate in training sessions to stay updated on changes in coding standards and healthcare regulations. I also subscribe to updates from the American Health Information Management Association, AHIMA, and the Centers for Medicare and Medicaid Services, CMS, to ensure that my practices remain compliant. Tip: highlight proactive learning and awareness of regulatory updates. Question 9. How do you prioritize multiple billing tasks? Here's how you can answer. I prioritize tasks by deadlines and complexity. I maintain a checklist of claims and regularly review pending tasks to ensure timely submission. I also communicate with my team to delegate tasks effectively when needed. By organizing work systematically, I reduce the risk of errors and ensure that all claims are processed efficiently. Tip: show organizational skills, time management, and the ability to work under pressure. Question 10. Why should we hire you as a medical billing professional? Here's how you can answer. You should hire me because I bring a combination of technical expertise, attention to detail, and problem-solving skills. I am experienced in medical coding, billing software, and claim management, and I understand the importance of accuracy and compliance. I am also adaptable, eager to learn, and committed to ensuring efficient billing processes that support the organization's financial health. Tip: summarize technical knowledge, reliability, and the professional value you bring to the organization. Final thoughts. Medical billing interviews assess technical knowledge, attention to detail, and the ability to manage complex tasks efficiently. Preparing answers to common questions, practicing coding and claim scenarios, and staying updated with industry regulations will help you confidently present your capabilities. Strong billing skills, combined with organizational and communication abilities, make a candidate highly valuable in healthcare administration. By providing structured answers, sharing real-world examples, and demonstrating your understanding of regulations and coding standards, you can showcase your readiness to handle medical billing responsibilities. Employers look for candidates who are accurate, detail-oriented, and capable of managing billing processes effectively, ensuring both patient satisfaction and organizational compliance.